Coronavirus. First about its morphology. It is enveloped RNA virus carrying petal or crown-like papillomer spikes and giving rise to appearance of solar corona. It possesses linear positive sense, single-stranded RNA of 26 to 32 kbp size. Classification. The family Coronaviridae is divided into two subfamily, Coronavirinae and Torovirinae. The subfamily Coronavirinae consists of four genera: Alpha coronavirus, Beta coronavirus, Gamma coronavirus and Delta coronavirus. Human coronavirus. 6 recognized coronavirus caused human infection. Most of them are Beta coronavirus except first two. They are Alpha coronavirus. First, human coronavirus 229E. Second, human coronavirus NL63. It is also called New Haven coronavirus. Then human coronavirus OC43. Then human coronavirus HKU1. Then fifth is SARS CoV, that is severe acute respiratory syndrome coronavirus. Then sixth is MERS CoV, Middle East respiratory syndrome coronavirus. SARS coronavirus and MERS coronavirus are transmitted from person to person and produced outbreaks and severe respiratory disease with a higher mortality. Then about its pathogenesis. Transmission. It is spread by coughing and sneezing, also close personal contact. SARS coronavirus also spread via droplets, rarely through air. Then few about SARS CoV. It has an incubation period of 10 days and it is reported, or the outbreak is first reported in China in November 2002 and it spread to some other countries also. Then source: animal including monkeys, Himalayan palm civettes, raccoons, dogs, cat, rodents. Then clinical manifestations like severe lower respiratory tract infection characterized by muscle pain, headache, sore throat and fever, followed by onset of respiratory symptoms like cough, dyspnea, pneumonia. Then about MERS CoV. It has an incubation period of 2 to 14 days and it is first reported in 2012 in Middle East countries and the source was camels and bats. Clinical manifestations include severe acute respiratory symptoms and it may develop GI symptoms like diarrhea, vomiting. The complications include pneumonia, kidney failure. Then moving to SARS CoV2 or COVID-19. It is first reported in city in Wuhan. That is, the first outbreak is reported in the Wuhan city, and the genomic and evolutionary evidence show pangolin origin. And the transmission include animal to human transmission, then human to human transmission, also asymptomatic carriers, then respiratory droplets via coughing and sneezing, then direct contact or via aerosol in the closed spaces. It has an incubation period of 3 to 7 days. Then about the transmission cycle of SARS CoV2. The bat coronavirus, that is the Minioptera bat coronavirus HKU8, transmitted to Manis pentadactyli. It is the intermediate host and the transmission is through direct contact. And from the intermediate host through the direct contact, it will infect or transmit the infection to incidental host Homo sapiens. Then from a human to human transmission occurs via direct contact or droplet spread. Then pathogenesis. From nasal and laryngeal mucosa, virus target organs that express ACE2 like lungs, heart, kidney and GI tract. Then pathophysiology. Non-structural protein and structural proteins contribute to the pathophysiology. Spike glycoprotein composed of two subunits S1 and S2 linked to host receptors. Then ARDS associated with the cytokine storm. It is deadly uncontrolled systemic inflammatory response resulting from the release of large amount of pro-inflammatory cytokines like interferon alpha, interferon gamma, interleukin 1 beta, interleukin 6, and chemokines like CCL2, CCL3, and CCL5. It has 3 phases: viremia phase, then acute phase with pneumonia, then usually a recovery phase. But when there is comorbidities like diabetes mellitus, hypertension are present, disease progress to severe form. Clinical features. These are fever, cough, sore throat, anosmia, shortness of breath, rhinorrhea. And in mild disease, non-pneumonia and mild pneumonia are the presentations. And in case of severe disease, dyspnea with the respiratory frequency greater than or equal to 30 per minute, then blood oxygen saturation less than or equal to 93%. And in case of critical disease, respiratory failure, septic shock, and or multi-organ failure or dysfunction are present. Then complications. Complications are ARDS, acute respiratory failure, acute liver or kidney failure, then DIC, secondary infections, then neurological complication. The differential diagnosis include adenovirus, influenza virus, human metapneumovirus, then para-influenza virus, respiratory syncytial virus, and rhinovirus. Laboratory diagnosis. First, about markers in diagnosis. So there is a window period during which antibodies cannot be detected in the serum. At that time, in the respiratory specimen, you can detect SARS CoV2 RNA and antigen. Starting from 7th day onwards, we can detect IgM antibodies, and then from 14th day onwards, we can detect IgG antibodies. It is about the markers in diagnosis. Other various methods of diagnosis include nucleic acid amplification test, like real-time RT-PCR, which is the gold standard of detection. Then also TrueNAT, it is also amplify the nucleic acid. Then biosafety level 2 is needed for molecular diagnosis. RT-PCR. Nasopharyngeal specimen or oropharyngeal samples are collected. Swabs placed in viral transport medium for transportation to clinical microbiology lab. Also sputum, endotracheal aspirate, and bronchoalveolar lavage are also collected. RNA extraction followed by qualitative RT-PCR is done. Primer probe sets targets SARS CoV2 RNA dependent RNA polymerase at envelope E gene, and that is enveloped genes. Then TrueNAT, it also uses polymerase chain reaction, that is RT-PCR, and it give result between 30 to 60 minutes. Multiple samples can be tested simultaneously. Serological test. IgM and IgG antibodies can be detected from the blood sample. ELISA immunochromatography methods are used. Then it can accurately assess prior infections and immunity to SARS CoV2. It is used for epidemiological studies such as ongoing surveillance, vaccine studies, risk assessment of healthcare workers. Then antigen detection. Monoclonal antibodies against the nucleocapsid protein of SARS CoV2 have been generated, which might form the basis of the future rapid antigen detection test. Other markers include elevated CRP, elevated LDH-AST, lymphopenia, elevated ESR, increased bilirubin, elevated D-dimer. Radiology. In chest X-ray, we get patchy or diffuse asymmetric airspace opacities similar to SARS and MERS. It is a bilateral ground glass alveolar consolidation with a peripheral distribution. That is we get in intensive care unit patient. That is, in ICU patients, consolidation pattern are observed, and in outside ICU patient, ground glass appearance are observed. Then CT scan. CT visual qualitative analysis has high consistency and can reflect the clinical manifestations. These CT images show bilateral multifocal ground glass opacities. Then prevention. Preventive methods include avoid close contact with a subject suffering from acute respiratory infections, wash your hands frequently, especially after contact with an infected person or their environment. Then people with the symptoms of acute respiratory infection should keep their distance, cover cough and sneezing with disposable tissue or cloth, and wash their hands. Infection control practices are also preferred. Avoid public gathering, use face mask. Then special precautions during incubation. Personal protective equipment, that is PPE, such as N95 mask, protective goggles, disposable gown long sleeve raincoat, disposable double socks and gloves. Treatment options. There is no specific antiviral treatment against coronavirus. The treatment options available include remdesivir, lopinavir or ritonavir, chloroquine or hydroxychloroquine, alpha interferon. Then antibody and plasma therapy are also available for these treatment options.